So the takeaway message from this article is that octogenarians presenting with non-ST elevation myocardial infarction may benefit from coronary angiogram as a treatment approach rather than just conservative treatment. And the results were consistent irrespective of frailty status. So my name is Boris Fishman. I'm a physician in cardiology division in Shiva Medical Center in Israel. The title of my work is Invasive Management in Older Adults older than 80 years old with non-ST elevation myocardial infarction. It will appear in the Mayo Clinic Proceedings. Older adults are underrepresented in most of clinical trials evaluating the treatment approach in patients admitted to the hospital with non-ST elevation myocardial infarction. Only one randomized control trial, titled After 80, which was published in 2016, addressed this clinical dilemma, concluding clear benefit for the invasive approach, including coronary angiogram, over the non-invasive approach. However, like most of other observational retrospective studies, this study did not address frailty, which is very common in the population of this age. Frailty was found in numerous studies to be strongly correlated with the adverse outcomes in older adults admitted with acute coronary syndromes, and therefore there is a still gap of evidence regarding the benefit of invasive approach among older adults by frailty status, in particular those with high frailty. In our study, we also found that frailty is among the strongest predictors for overall mortality, which was the outcome of our study. In our study, we included more than 2,300 adults older than 80 years. A quarter of them were treated invasively. We observed overall adjusted 40% decrease in mortality among those treated invasively, which was also consistent in low, medium, and high frailty groups. Several studies so far, including ours, have shown that frail adults with non-ST elevation myocardial infarction are less likely to be treated invasively. Our results show benefit of this approach among these patients and suggest to consider to use more frequently the invasive approach in patients with non-ST elevation MI older than 80 years old. Our findings may increase the proportion of frail older adults with non-ST elevation myocardial infarction treated eventually invasively, hopefully to improve their outcome. Due to the retrospective of this study, there are several inherent limitations which we try to overcome in our study. Several biases such as immortal time bias and indication bias. And still, after we use several statistical tools such as propensity score matching and inverse weight probability, we still got the same results of a clear benefit for the invasive approach among older adults. But hopefully there will be a randomized clinical trial which would be able to support our findings, and hopefully it will make a bigger change, a greater change in the clinical practice of the treatment of older adults with non-ST elevation and myocardial infarction. So to conclude, in our study, we found that older adults may benefit of invasive approach when they present with non-ST elevation myocardial infarction. And I invite you for more information, more details in our full article in the Mayo Proceedings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.